What's up, guys, and welcome to the Level Health Podcast. Today, Josh is interviewing Dr. Krystle Zuniga. Dr. Z is a registered dietitian and has a PhD in Nutritional Sciences. She has over 13 years of experience working in the complex field of nutrition and cancer. Her focus is on developing individualized nutrition care plans for cancer patients and survivors. Dr. Zuniga is at the forefront of a unique and emerging niche in the healthcare space. This isn't a topic we hear about much, and it's clear that this population is underserved in many ways, so we are so grateful to get to have someone like Dr. Z on the show to be able to share her information. We've learned so much about how nutrition and fitness can impact treatment and recovery. Big thanks to Dr. Z for coming on the show. You can follow her on Instagram at real.nutrition.science and at Cancer Nutrition HQ. We'll have both of those linked in the description below. For those of you that don't already know, our website, Level Health, is a directory, community, and network of qualified personal trainers. We want to help create a space where clients are able to find the right trainer for them. We have accounts for both clients and fitness professionals. Client accounts are always free, where you'll get access to our trainer directory and other resources. Our Basic Pro option is now available for trainers, and our Verified Pro membership will be available early next year. If you haven't signed up already, head over to levelhealth.net and set up your membership. Thanks for listening, and if you have a second, we would love it if you gave us a rating and review so that our podcast and the professionals we interview can get more exposure. You can also subscribe so you don't miss any of our new content. Thanks, and we hope you enjoy the episode.
Anyway, so from what I could find, you are doing amazing things down there in Austin. And it seems like you have a lot of hats, a lot of stuff that you're trying to accomplish within your field. And I just wanted to start by asking you, Krystle, could you give us some background on who you are and why you do what you do?
Yeah, so I'm a registered dietitian. I specialize in oncology. I work at an outpatient oncology clinic, and I own a private practice. I also do a little bit of teaching. I used to be a professor in nutrition, but I really found more of a calling in the space of communicating the science and directly applying that into clinical care. So I first got interested in oncology when I was an undergrad. I helped with a research project that was looking at how a certain compound in pomegranates affected prostate cancer cells. And that's what really opened my eyes into how our food, more than just nutrients, can impact the development and progression of cancer. So I went on to pursue my PhD in nutrition. I also did research on foods and their impact on prostate cancer. But really what I like about the clinical care part of it is, I said, funny story is when I was a kid, I said I wanted to be a puzzler when I grew up, like very high ambitions.
A puzzler.
Not a real job, not a real job. But I love doing puzzles and kind of thinking about it now. I really love figuring things out and putting the pieces together. And in oncology, we've got a lot of pieces to put together. They've got their treatment plans, complex surgeries, also whatever comorbidities they might have, and then the people and their families and their environment in general. So honestly, I was really drawn to oncology care because of the complexity of it. It's like acute care in an outpatient setting and really challenges intellectually. But now the more I have been in the practice, I enjoy it and working with the individuals, and they're who I'm really in this for, and my opportunity to advocate for patients. And I find this to be a population that really needs to be empowered to know what questions to ask their healthcare team, how to weed through the misinformation, and to have someone who has empathy for their experience. So I have also tried to develop a social media presence because there are a lot of people who will never get access to a dietitian during their care and want to help give them some good scientific information, because there's so much misinformation in the oncology field. I mean, and the nutrition field and fitness field in general, but really it becomes to a level that can be dangerous when someone is trying to make decisions about their health and treatment plans. So
Yeah, absolutely. I can't think of, off the top of my head, a more vulnerable population that, I mean, a lot of times it seems like this kind of gets sprung on them right away, and it's just incredibly overwhelming. And I'm sure we'll touch on that quite a bit today, and like how you're trying to help people through that process. I think if you can harness that childhood curiosity, though, you said you wanted to be a puzzler, like I think that's kind of the key to like mental well-being long term. If your career can match that like passion that you have, and you can harness that a little bit. Are registered dietitians common within cancer care? Is that something that is kind of standard procedure?
No, it is not, unfortunately. And there was a recent paper published a couple years ago that did a survey of cancer centers across the US and found a ratio of one dietitian for every 2,300 cases. So there really is going to need to be, if there is a dietitian, they have to prioritize who they're going to see. So it will likely be those that are already at high risk or already malnourished. So someone coming into treatment and quote healthy might not get to see a dietitian during their care. All that's required for a cancer center that is meeting the Commission on Cancer standards is that a dietitian would be available for referral. So all it requires is that an oncologist would refer out to a dietitian if needed. So there are no requirements to have a dietitian at a cancer center.
Interesting.
Yeah, and also oncology is not a huge field. We have a dietetic practice group. We're a pretty small knit group, but there really aren't too many dietitians specializing in oncology. So if someone wants to see a dietitian, they would also try to have to seek out someone who has that expertise, because it really is a whole other level of understanding of the different treatments and medications that go along with that.
Yeah, I can imagine. It just adds a huge layer of complexity to everything, it seems. And that feeds really well into really my first question. What impact can the diet have on people that are experiencing and going through a cancer battle?
Yeah, well, cancer treatments are designed to kill cancer cells, but these treatments can also damage healthy cells. We don't have as many targeted treatments available, and these healthy cells, damage to them can cause side effects that lead to difficulty eating, nausea, vomiting, limited appetite, and then also surgeries that someone might be going through can also impact normal digestion or absorption. So there's this really difficult area where there's an increase in calorie and protein needs to support recovery, but there's more challenges in eating. So we need more nutrition, but there's more challenges in eating. And the benefits of adequate nutrition is multifactorial. There is good evidence that maintaining body weight and muscle mass can help prevent malnutrition, which can reduce side effects of treatment, prevent treatment delays or breaks, reduce the risk of infection or hospital stays, and then also supporting overall quality of life as well. And it's estimated that up to 80% of patients during treatment will develop malnutrition. Of course, that will be more common in some cancer types like pancreatic or GI, lung, head and neck. And that malnutrition itself is directly responsible for 20 to 30% of cancer deaths. So poor nutrition can have a direct impact on someone's survival, on someone's tolerance to treatment, and their ability to stay on the treatments that we know can improve survival. So often when people think about nutrition and cancer, they're like, oh, that means more vegetables, more fruit, juicing. Like actually, this is about increased nutritional needs and supporting the overall nutrition status of the individual, and trying to navigate how to maybe modify their diet based on side effects that might be having from treatment or surgeries that impact how they're able to eat and digest foods. So there's really more than just like eat more protein or eat more vegetables. It really is got to be individualized for everybody.
Yeah. Or start juicing all of a sudden, all those kind of things that I'm sure are quite common. I can see why you are really dedicated to this, because 20 to 30% of cancer deaths caused by malnutrition. That is pretty shocking. I had absolutely no idea, and I don't think a lot of people have any idea at all. What are some common nutrition myths and misconceptions? We've kind of like talked about it a little bit, like just eat more vegetables or something like that. It obviously goes much more deep than that.
Yeah, great question. I think one of the biggest one I get is like that there's one anti-cancer diet. So when someone has cancer, like, okay, what do I need to eat? And there's really no one diet for anything in the realm of health, and also to understand that cancer is not one disease. Cancer is this umbrella term for several hundred types of cancer, and even the cancers that come from the same tissues can have different mutations, different subtypes. So even in the realm of cancer treatment, there's development of more targeted treatments dependent on the mutation that is in somebody's tumor type. So I think this idea that there's one diet that is going to support an individual really doesn't understand the complexity of cancer and how that is happening. And kind of what's mainstream right now, like ketogenic diet and intermittent fasting trends are also being talked about in oncology. And there is some interesting animal studies, but we just do not have enough human evidence on their benefits. And there are even a couple of clinical trials in some of these types of diets, but for people to understand that just like any other recommendations, we don't change based on one study or even a small handful of animal studies. Just because something interesting was seen in breast cancer patients does not mean that's going to be applicable to someone with pancreatic cancer. We really need stronger research, and it needs to be stronger than what we have already established, which is the high risk of malnutrition and the impacts of malnutrition as well.
Yeah, that makes sense. I mean, you tell people, is it who, I don't want to try to cast any blame here necessarily, but does the media tend to like catch on to these, single studies that are maybe just looking at some kind of mechanistic data, and they put that out there, whether they mean to be, harmful or not? Where are these kind of ebbs and flows of fads coming from?
Yeah, I think, right, the media misrepresentation of research, like simplifying, like, oh, for example, like tomatoes are great for cancer. It's like, well, maybe the research was more on a compound that was in that food, and how much of that compound would you actually need to get to have that benefit. So things get into these big headlines, but when you actually read into the research, it's like, does this even have clinical relevance, or is this just an interesting finding? And so, or a compound in something then turns into a supplement that patients think that they need to be taking. So there's that, but there's also people who are trying to market to cancer patients that they have a diet that cures cancer. So there are people who are directly giving misinformation and dangerously.
Yeah, I wanted to kind of stay away. I wasn't going to ask you about that specifically because I think it's often more productive to focus on the positive and try to overcome that. But is that a pretty prevalent problem? Are there people out there doing those things? And then are there any entities that are regulating that and actively trying to seek out those things? Because I can't think of a population that is at a more crucial point in their life that they need the correct information. They need people like you and not these snake oil salesmen.
Yeah, right. And of course, I'm sure you can find some case studies of someone who did well without treatment, but we don't make treatment decisions based on a case study or without even fully knowing someone's full medical history. I'm not going to call out this person's name because I don't want to give them more attention, but they're saying that their diet cured their cancer and has a huge business behind it. They fail to mention that their treatment was actually able to be treated by surgery alone, and they got the surgery. So they did get treatment. Yes, there might be a recommendation for chemo after, and they opted not to do that, but survival rate is still pretty high without doing the chemo after surgery. So it's super misleading to try to say that what you did is going to work for all cancers, because every cancer type has a different level of aggressiveness and different treatments needed as well.
Is it difficult for you? Because we've followed your content for a while now, and we appreciate a lot of your messages. And is it hard for you to focus on the basics and speak about these basics, these nutritional kind of principles to people when there are, these a lot more flashy, again, like salespeople putting out just really just clickbaity information? Is it difficult for you?
Yeah, and honestly, it's challenging professionally too, because people might ask about a supplement I've never heard of. I'm like, I have no idea. And not because I am not well versed in the research, it's because there is not research on that. But as a patient, it's like, well, I read about this. How come you don't know about this? So I think sometimes it might even undermine our expertise, because we can't keep up with all of this level of misinformation. And so there is a lot of myth busting we need to do, because they come in with some questions that takes a level. Well, that doesn't work because of this, or we wouldn't recommend that because of this. And don't get time to really get to the foundational principles of what adequate nutrition means to them. So that's a challenge. And also I feel like undermines our profession and what we're doing that's based on science.
One more question on this before we move on to slightly more positive topics. Is the supplement industry particularly problematic within this population? Because within the average population, the supplement industry is a problem, but it's almost just like, I'm going to say no harm, no foul. You're wasting money, and there are people getting hurt from this kind of stuff. But again, within this population, the people experiencing cancer, like that can be incredibly sinister. Is it as big of an issue with them?
Yeah, it's even more of an issue, and that then we have some concerns about, could that potentially interfere with the effectiveness of treatment or have negative impacts on their treatment. And there is a natural medicines database that I'll look up some of these supplements that people want to take and see if there's any potential interactions. But some of them we just don't have enough research on. And all we can tell a patient is we don't know. And typically the oncologist might say, we'd like for you not to take this because we don't know how it might interfere. Here's what we do know might be safe and fine, but here are some things that we just don't have enough misinformation on. And
absolutely. So I'm not going to ask for like action items for people nutrition wise, because I don't think, like from what I've heard from you thus far, there's not going to be any single ones. However, can you give us just a few principles? You said that just malnutrition is a concern, even just from an energy perspective, an energy balance perspective. Are there a few kind of like non-negotiables that you try to instill in people?
When it comes to their nutrition, if I had to like really boil it down for telling a patient, so you've got to focus on getting enough calories and getting enough protein and what it takes to get there. So some also basic tips I give to them is also having some self-compassion around this. Like a lot of patients who come in with like, I'm going to do the juicing, I'm going to eat only whole foods, and then they get kicked in the butt from extreme nausea or no appetite whatsoever. So we've got to be flexible with your diet and food choices to keep your body fueled to get through these really harsh and aggressive treatments. So do what you can when you can. When you are feeling well, it might be a great time to have the juices and the salads and that, but when there are days where you just need to get through, focus on your hydration, focus on getting in some type of fuel.
That's fantastic. That's fantastic. I always try to bring it back to some kind of like foundational from people to work on, some kind of framework for people to work on. And it seems like that kind of rigid restraint where you think, oh, if I can't be perfect, I can't do anything, or I shouldn't do anything. I shouldn't have this food that's going to provide me this energy that my body needs because it's not a quote unquote clean food. So I could see, I mean, that across the board within all populations, that kind of rigid restraint, that hyper-focused dichotomous thinking isn't necessarily beneficial long-term at all. Do protein requirements go up significantly during this experience?
Yes, our current recommendations are anywhere from 1.2 grams per kilogram of body weight to 2 grams per kilogram body weight. So it's almost double what we would say. And I'd say even in the fitness industry, we know that higher needs are probably beneficial for most people. But yes, because there is this acceleration of muscle loss because of all of this inflammation, steroids, fever, less physical activity, all of these things are having a hit to muscle. And that loss of lean mass has been associated with poor treatment tolerance and poor outcomes. So we really need to meet those increased protein needs to not cause that muscle wasting.
Excellent. And that kind of, again, feeds into my next question on the topic of muscle mass preservation and, well, just maintenance, really. What role can fitness play in this experience for people? How can they best utilize that for their benefit?
Oh my gosh, everyone needs to be exercising. Just kind of talking about, there's really a big push for exercise to be prescribed as the standard of care. Because really, if we could turn the benefits of exercise into a pill, it would be not only demanded by patients, it would be prescribed by every oncologist, because the benefits of physical activity during exercise are so immense. Actually, 2019, the American College of Sports Medicine put together a roundtable of experts from different organizations like National Cancer Institute, American Cancer Society, just to name a few. And they reviewed the scientific evidence and provided recommendations about the benefits of exercise for not only prevention, which I feel like a lot of people know about that piece, but treatment, recovery, and improved survival. So just some of the benefits that have been shown from exercise: it can improve survival and reduce the risk of recurrence for several cancers, improve fatigue, anxiety, depression, physical function, quality of life. Some of these cancer treatments are cardiotoxic. So physical activity has been shown to reduce some of these negative impacts on the heart's function. And as we kind of talked about, that promotion, maintenance, and building of lean mass has been shown to help impact the tolerance to treatment, because loss of lean mass is going to impact physical function, but also their ability to tolerate treatments. Another cool thing coming out, it's colloquially called a chemo brain, but this cognitive dysfunction that can happen during treatment, not just during chemo. Like, they've seen this happen in those that are on hormonal therapies or radiation, that those who are more physically active have less severity of these cognitive dysfunction.
Interesting.
And this is a really interesting side effect, because this is something that can persist after treatment and can impact people's ability to get back to work if they're having a lot of this brain fog and difficulty in their memory or focus as well. So physical activity has benefits there, reducing pain. Also, people have other chronic conditions as well. And so physical activity has benefits on managing those types of comorbidities, say like diabetes or heart disease. Bone density, kind of been talking about this one lately too. Some treatments specifically like have the whole combo platter of things that have a negative impact on bone density. So in breast cancer, the early menopause, hormonal therapies, these are things that have, and they're women primarily, all these things are impacting bone density. Exercise, we know the benefits on that. And then another big thing is like enhancing the immune system. So when someone's going through chemotherapy, how they're deciding if someone will go through the next round of chemo is they're looking at like neutrophil count, white blood cell count. And so physical activity can help with immune function, keeping those counts up so that someone can stay on their treatment cycles, and also reduces their risk of infection because this is an immunocompromised population. So essentially, kind of name something negative that happens during cancer treatment, and exercise may be able to help with that. So it's really been a big push to like, how do we get this to be something that's prescribed, whether that's a referral to a physical therapist or a cancer exercise specialist.
I'm absolutely going to talk about that later, because I wouldn't necessarily refer or suggest many personal trainers or many people to certain personal trainers. It's not necessarily feel that professionals take themselves seriously enough that I think that they could work in a team like this. Before we went to that section, though, I wanted to ask, what if somebody hasn't started exercising before they were diagnosed with cancer? Is it still okay for them to start?
Yeah, absolutely. And that's where something we do in our outpatient setting is automatically referral to a PT, physical therapist. So they get that baseline assessment and know where they're at and what they need to improve upon there. So it's never too late. It's kind of meet someone where they're at. And that's where it really takes working with a professional who is going to do that baseline assessment and make the right modifications.
Very cool. Very cool. So this may be somewhat theoretical or hypothetical currently, but I'm always trying to advocate for personal trainers taking on a little bit more of a healthcare system role, a very entry level healthcare system role, however, but that doesn't mean that we can't take ourselves seriously enough to provide these kinds of services to people. So I wanted to ask you, what role do you see that personal trainers in the future could potentially play in kind of this multidisciplinary team helping people in this situation?
Yeah, I think they could fill a very important role, because even with a PT referral, many insurance have like limits on how many sessions someone could see physical therapists. They might be able to see them again for a different diagnosis code, but they might tap out before they're able to get to some of these bigger benefits from exercise. So there's limits within using certain healthcare professionals for the exercise piece. But as far as personal trainers, there are opportunities to get additional training and certifications in working with cancer population. Specifically, the American College of Sports Medicine has the cancer exercise trainer certification. And that does require having a certain amount of hours working with population, not necessarily oncology, like if you work with older adults or people who have other chronic diseases. So that's a certification that they developed in collaboration with the American Cancer Society. Also, there's the Cancer Exercise Specialist certification available from ACE Fitness, as well as the Cancer Exercise Training Institute. So there are opportunities to get that additional training so that if you want to be incorporated as part of the team, you can show that you have this understanding of what are the impacts of cancer treatment on their physical function, what modifications are you going to need to make in working with this population. But I feel like if we could incorporate and having more professionals available to support exercise, the better, because you're going to run into the same thing. Like if you only do it within the healthcare realm, we've got insurance to deal with, you've got backups of wait lists to see people, and we need to get the exercise implemented ASAP.
I've seen that I've worked with advanced age population quite a bit. And so obviously, or not obviously, but I've been able to work with physical therapists in that specific situation, because you're right, like they may only be able to get into the physical therapist once or twice a month, and they need these kind of repetitions consistently. And I'm glad to hear that there are these. I'm going to look into these other certifications, because I feel like those are absolutely crucial if you wanted to take that next step and really be part of a team that can actually help people on that level, for sure. I mean, I think there's a lot of personal trainers that are fine with just working with the average population and, you know, helping somebody lose 10, 15 pounds, getting abs for the summer or something like that. But there's a whole other subset of the personal training profession that wants to be taken a much more seriously and takes themselves much more seriously, that they'd want to work with those kinds of people. What are some considerations for the appropriate application of exercise within this population? We don't have to go very specific, obviously, because I don't think that you can, but what are some general guidelines?
Yeah, I think, and kind of foundational of being a personal trainer would be like that individualized prescription. You need to do that assessment of where they're at and what are their limitations, because you can't assume that a 20-year-old male, it could be a cancer survivor, is going to be the same as a 20-year-old male with general fitness. And that's actually a population that is very underserved, is that AYA, the adolescent young adult population, because there's a lot of assumptions that you're young, you're healthy, you'll recover, when they might have the strength and mobility of like a 65-year-old after treatment. So don't think that anything like age or weight or comorbidities is any indicator of their abilities that they might have. So they can have things like neuropathy, poor balance, things like with breast cancer, lymphedema that can impact their range of motion. So I think the appropriate application or things to consider are, what are these long-term side effects, or if you're working within during treatment, like what are these side effects that could impact the safety of exercise, and to modify appropriately.
Yeah, individualization is absolutely key, and just in just everyday interactions as a personal trainer, whether that's within the program design or within each individual day. So it's not surprising that that is, like you said, the foundation of it. You need to consider that each individual you're working with is an individual with their own strengths, limitations, and don't impose any preconceived ideas of what you want to do on them, which that was something I learned pretty early on in my personal training career. And I think that honestly, the success that I've had with clients was really predicated on that, because you would have the survivorship bias, which is something that I end up talking about a lot when I talk with personal trainers, this kind of survivorship where they were able to achieve success despite what you did with them. And that's absolutely not something that you can then apply to people within this population or many populations.
Agree. And I'd say too, to also develop programs that have a functional fitness idea around that, like things that they need to do, like getting up the stairs of their house, picking up their own groceries, playing with their kids, so getting up and down, sitting down on a chair, like those types of basic functions that impact their quality of life and ability to get through the day is more important than being able to run a 6-minute mile. That's not important. For what
I haven't ran a mile in 6 minutes in my entire life. So you said functional, and I wanted to touch on that for a second, because I would like for us to be able to get that word back, that phrase back from these kind of, I don't want to say, I don't know what you would call them, these people that are standing on Bosu balls and, doing all this crazy stuff for quote unquote functional fitness, when in reality, it's referring to functional capacity. What are you doing in your daily life, and what do you need to be able to do? Where are your limitations in what you're going to perform on a daily basis? And I found that is such a rewarding, it just makes sense just from a strategic perspective, because as a personal trainer, you want to provide results for people. Where are they going to see these things? They're going to see these in their daily life. Like you said, standing up and sitting down. How are they going upstairs? That's one of the hugest ones. Like if you're walking upstairs in a messed up way every single day, that pattern is getting ingrained. Like if you're just compensating to get up, if you're compensating to get, out of your car every day, like there's these things that people don't even realize, because over time they degrade, or their ability to do so degrades. And if you can start creating progress in that aspect, I've found that that's something that it's almost like compound interest. Like it feeds into their self-efficacy more than any of these things that they're doing in their daily life could be.
Oh my gosh, absolutely, absolutely. And with the cancer population too, even more important, because they already feel like they're not able to keep up with their day-to-day life, and how that impacts their mental health when they are out of treatment, don't see their providers as often. I'm just supposed to navigate this new world on my own. And so having people behind them that are helping them get back to, I know they hate this word, but new normal, essentially. Like how do you make, like you said, that self-efficacy piece come in and helping build their confidence to make also fitness part of their journey from now on.
Exactly. I'm going to move on, because I have a tendency, I want to just harp on this one for forever and talk about, maybe we could go into like how important resistance training is. Like I'm very partial to that and everything like that. Would I be correct in saying that is a beneficial, we don't have to go too in depth on it, but if you can, appropriately applied resistance training to support that lean body mass is a good idea.
100% is needed. When we talk about how to treat like cancer cachexia, which is very similar to like sarcopenia, but cancer cachexia is this muscle wasting that can happen during treatment. It cannot be treated by nutrition alone, cannot be treated by just feeding. You need anabolic stimulators like resistance training. So in this discussion about how do we treat cancer cachexia, it's multifactorial, like trying to address the inflammation piece, the nutrition piece, but also that incorporation of resistance exercise, and maybe some other stimulators that can promote anabolic stimulus. But yeah, resistance training is a key part of this. And of course, when I'm working with patients who might just feel like only walking is what they can do now. I'm not going to discourage that. That will have benefits. But I really feel like that is an area of the resistance training piece that a lot of people don't know how to do, and how to do that now safely within these new things that they have, like the neuropathy or off balance or have swelling in the limb. How can I do resistance training?
Okay, I'm glad we touched on that because like I said, I'm very partial to it because when done correctly, I feel like there's not a form of exercise that can provide long-term dividends in the way that resistance training can. Although I do agree that oftentimes it's kind of stolen and misapplied for sure. So I think that within this population, finding a personal trainer that can apply, or physical therapist, but I mean, I don't know that physical therapists are focused on putting on muscle too much as opposed to like gaining function or regaining function of those muscles. Are there any long-term studies on resistance training for that cachexia, for that muscle wasting?
Ooh, as far as long-term studies, that I'm not as aware of, but there have been intervention studies that have used nutrition in combination with resistance training to see the impacts on muscle. There was a recent systematic review or meta-analysis that came out about breast cancer and exercise during breast cancer, and found that like actually resistance exercise can be used as something that you can build muscle during treatment. It's not just a whole downward trajectory, that there is an opportunity to build new muscle during treatment.
That's amazing. And I mean, you see like in untrained individuals, just cycling or even walking can prevent, or not prevent necessarily, but create that anabolic stimulus for some amount of muscle growth if you're not trained. So if anything, like if you've never lifted weights before and you're in this situation, it's going to be potentially easier for you, just like it would be for anybody. If you go in the gym for the first time, it's going to be pretty easy to put on weight, and eventually it'll stop being so much. So, okay, awesome. I got that checkbox there for us to talk about the benefits of weight training past just, I think people tend to think it's just still like a bodybuilding pursuit. It's not necessarily for health, but it really is. It really can be.
Yeah. And I actually try to use that word when working with patients. I'm like, you are a bodybuilder right now. We need to build your body up. So yes, we're going to use these types of strategies that might seem a little bro-y, of increased protein and more resistance training, but that can be applied in the clinical population. It needs to be more applied in the clinical population.
That's so funny because I consider myself, I don't like using necessarily a label for this, but like a lifestyle bodybuilder, because I'm not stepping on stage, but I want to make sure that I'm turning 30 this year, and I know that my muscles just going away throughout these coming decades. So I want to pack on as much as possible for later on. So, okay, I know I've said we've touched on this enough, but we'll move on to the next question. How can people just generally undergoing cancer treatment be supported overall, whether that's from family members, healthcare professionals, just in general?
And this is something too that I have really enjoyed learning from the community that I've built on Instagram, or also in talking with patients, is some of their common frustrations that they've expressed to me is a lot of the unsolicited advice that they get from people. For people to learn, like, that's not necessarily supportive. That, oh, have you tried blah, blah, blah? Or saying, well, at least you don't have this, or at least it's not stage 4, or this is part of the plan and you'll learn something from this. That's not helpful advice, and it's actually pretty dismissive. And I think that's something as people who want to support someone going through cancer, is learning to sit with this uncomfortable situation and the feelings that this person has, and they don't have to be happy all the time. This sucks. It's pretty shitty, and it's okay to say, yeah, this sucks, but I'm here to support you. And also, when it comes to that support, not this, well, let me know how I can help. Just help. Bring them something, bring them a meal, send a care package, offer to take them to an appointment, just sit with them so they can vent. That's showing support too. So when we talk about support, it's not just like, here's a support card, like really showing up for people in a really difficult time in their life. And also to know that that support is needed even after treatment is done, and needed more so. A lot of people feel now they don't have the support of their healthcare team anymore. They're not getting those regular check-ins, but they're dealing with a lot of the aftermath of treatment. both mentally and physically. So just showing up for them throughout, not only during treatment, but also in the aftermath that they're left to kind of deal with. But I think one of my biggest pieces of advice is don't give the advice about anything related to health unless you're part of their healthcare team. That's what their healthcare team is for. You might mean well, as we've kind of talked about today. People don't really understand the full complexity of cancer and its treatment and everything that a patient goes through as well. And talking about weight, I've heard so many patients say like, well, or people have made comments about their weight loss and how that's a positive thing. Oh, it's kind of gross how that's talked about. It's like, no, this is not a positive thing. And we talked about that weight loss is muscle loss, and that's reducing their tolerance to treatment. That means they're not eating well. That means they're not fueled. That's not a good thing.
Something that I've learned from working with and speaking with Gabrielle and Shannon, the comprehensive coaching crew, is it's almost never a good idea to compliment somebody on weight loss. It's never going to be a net positive for somebody. And you talked about the unsolicited advice. I think that you're right. It is very dismissive. And also, I think even as a healthcare professional, whether that is, if you could include personal trainers in there, if you could dietitians, whatever it is, unsolicited advice doesn't seem to be effective at all, let alone just off the cuff saying something to somebody. Oh, have you tried this one that I saw on BuzzFeed a year ago, and I read the title and that's it. And here you go. Here's this information. It's like, that's not going to help anybody. And I think that happens across a lot of realms for sure. But I think that within nutrition, especially, people tend to think that they are entitled to their opinion, but that doesn't mean you necessarily need to share that with anybody at all. And it's within the nutrition, I think it's especially problematic because everybody eats food and everybody has an opinion on how to eat appropriately or how they think that. How has your community, you mentioned that you've learned a lot from them. How has your community kind of driven you? Because I think, like I said earlier, like we talked about earlier, it can probably feel like an uphill battle for you often, going against these kind of myths and misconceptions with practical advice and logic. How has your community kind of helped you along the way?
Yeah, they've been so, like the things I just talked about, like I didn't think about that, how much unsolicited advice that they have to weed through and how much pressure that puts on them. Like, do I need to be trying this supplement? How do I find out the information on this supplement? I don't have a dietitian to talk to. My oncologist doesn't bring this up. So really, they've helped me realize how we need to put more information out there in a way that is more accessible and is listening to their concerns and has that empathy piece behind it and that understanding of their situation. Because also, there is tons of information online from like the American Cancer Society or other organizations, but those are like static websites that don't have a person behind it. Well, I mean, there's people that create it, but not someone who kind of can bring that to life for them and talk through them, talk about these things with them. Sorry.
Yeah.
So
yeah, that makes sense. I wonder if a lot of these entities, for lack of institutions that are authorities in this space, could benefit from getting like some kind of spokesperson that's just like very animated, very colorful, very passionate about what they do to engage with people on the social media and things like that. Are there any, besides you, are there any I guess we can go specifically within the nutrition realm for cancer patients. Is there any other accounts? Is there any other authorities that are kind of fighting the same battle as you?
Yeah, there's another account. I think her latest handle is Oncology Nutrition RD. She has a much larger account than mine, but she's got great content on there too. Breast Cancer Nutritionist is another one for more breast cancer focus. My gosh, there's so many. I feel like I'll do an injustice. And by so many, I mean, there's like 10 of us on there that kind of support each other through this. But really, I think what you're saying is such an important point. Like, can we bring this content to life and have spokespeople talking about the exercise piece, the nutrition piece, that not to undermine that value of social media and the community that you can build. And that's why I think it's been really cool is kind of seeing the comments underneath my posts where people talking about their experience with each other and sharing advice or like, I get that too. So letting there be a space for community, for other people who also want to follow the science, that they feel like I'm part of this community. We're the science people. And because I think that's what some of the misinformation people have done really well, is that they create a community. They've got a face there that is showing up. And so it's like, I can trust this person. And so we can use those same tactics in communicating the science.
Yeah, like it or not, social media is a source of information for people. And it's the same thing. I was talking to a personal trainer recently on the podcast, and we were talking about kind of sales tactics and stuff, and how there are some really shady ones out there. And really how, certain personal trainers, instead of focusing on being able to help people and improving their skill set, they focus on the advertising and the marketing side of things. And, one side of that, you could be really pessimistic and discouraged from that. But the other side is, okay, why don't we use those same tactics for good rather than quote unquote evil? And I think that within this space specifically that you're in, you're not going to be able to get away from social media and things like that, and people getting their information from there. So I think you really just have to kind of join them in that space where they are, and then try to put out good information like you're doing. Exactly. So.
Yeah. Like, so you have great organizations, the American Institute for Cancer Research, American Cancer Society, as we talked about. But if you look at their social media presence, it's like a static post. Is anyone responding to the comments? Where's the face of a person there that is having and talking to people, like talking to people, not just like, here's some facts. Really bringing it to life.
That's interesting. I wonder how long that will be until they do kind of engage with people like that. Are there any other resources, before I ask you my final question, are there any other resources that you like to send people to in this situation?
As far as information about nutrition and cancer. So the American Institute for Cancer Research is probably my favorite resource to direct patients to. This is a nonprofit organization. They have a great website. You can sign up for a newsletter that always sends healthy recipes. They also have online programs with kind of a coaching. I don't know how much it like brings things to life, but at least it's something people can work through at home if they want some basic information. And it's all evidence-based information.
Very cool. Yeah, that's what I wanted to ask, because it can be hard for people to, everything can appear evidence-based if they use the right buzzwords, but it's good to hear from somebody that's done their digging. So we'll link to and tag all of those people in there. So that's why I was asking, and like the show notes and everything to help direct people that direction. But all right, Krystle, for my final question, how do you feel that people working within the realm of cancer and nutrition specifically can improve just overall?
Ooh, good question.
We touched on a lot of them already, I'm sure.
I know. Well, it's like when we come to like with the dietitians that are working in nutrition and cancer, we're doing the best we can. I really think that we have a great community of oncology dietitians. Like we have a practice group, and we're really just trying to show up the best we can with the high amount of patients and the few amount of us. But as long as we can consistently get out there and go up against that misinformation, we've got a community behind us and feel confident in that. And I feel like for those in the research area, we need more research in this area, period. And I feel like we're doing the best we can as the people in the clinic, bringing this stuff to life, but we also are kind of limited with how much information we really do have on nutrition and cancer. It is not the same levels what we know about exercise and cancer, like during treatment.
Really? That's interesting. Do you know why that is? I know I'm sure it's incredibly difficult to get a sample of cancer patients. So like you've mentioned, it's probably a lot in animals at first, at least. Why is it so difficult, or why is it appear to be so difficult to get nutrition?
How do we implement nutrition interventions during treatment?
That makes
the biggest challenge, right? With exercise, we have some good, like, all right, we're going to put you through this six-week program. This is our prescription that we're testing out. So there really is more information. And there's also going to be more information in the more common cancer types. So we know a lot more about breast and colorectal and lung, but what about our pancreatic cancer population, our blood cancers, those types of things? We don't have as much information as well. So we have a lot of good information as far as like epidemiological cohort and prevention stuff, or survivorship after treatment. But it's like this key time, like going through cancer treatment, we just don't have as much research.
That makes sense. Yeah. Something I've learned about research is there's never going to be like the perfect study. There's never going to be the perfect opportunity to do this research at all. So that it makes sense that that's a problem. But I think that having people out there like you kind of deciphering what there is, and also then putting it into practice in the clinical setting, and then providing those results, and just continuing to develop the body of knowledge across this space, it is fantastic.
Yep, I agree. And then for the non-dietitians that might be working with patients who are asking nutrition questions, just direct them to a reputable source. Know your lane, stay in your lane, and just understanding how complex this really can be for them navigating diet during treatment.
Mm-hmm.
So trying to direct them to good, reputable, evidence-based resources.
Well, Krystle, we'll send them in your direction. So we appreciate you coming on. And I mean, this is a field or an area that I think a lot of people tend to not want to think about until it's too, I would say too late, but until it's forced upon them. So we appreciate that there's people out there putting out great information and kind of guiding people in the right direction during this incredibly vulnerable time in their lives. So thank you very much, Krystle.
Yeah, thank you.